I'll speak about water drinking test and glaucoma. Water drinking test was first utilized around the 1920s as a method to diagnose glaucoma, but was later abandoned in the late 1970s due to its lack of specificity and sensibility. It has recently re-emerged as a possible way to determine the competency of the trabecular meshwork. IOP is a critical factor in glaucoma management, and dynamic assessments can provide valuable insights. However, it was associated with markedly unacceptable false positive and false negative results. Armali et al. Found a good correlation between IOP in the water drinking test and that in the 24-hour IOP curve. So it is now used as a useful tool to assess the IOP peaks. It has been speculated that water loading changes the plasma osmotic pressure gradient and causes an influx of water into the eye. Greenfield et al. Proposed that WDT raises IOP by increasing episcleral venous pressure. Another proposed mechanism for IOP elevation is decreased aqueous outflow after WDT. WDT can cause parasympathetic nervous system stimulation, which may cause collapse of Schlemm's canal, leading to increased IOP. Water drinking test stresses the trabecular meshwork by increasing episcleral venous pressure, hence allowing the outflow facility and peak diurnal IOP to be evaluated. Furthermore, high IOP fluctuations have been implicated in glaucoma progression, most notably in the advanced glaucoma intervention study. Pre-test preparation includes patient education and baseline IOP measurement. The patient drinks a standardized amount of water within a specified time frame. IOP is monitored at regular intervals after water consumption. IOP measurements are recorded and analyzed. We ask the patient to refrain from drinking any fluids for at least 2 hours before the test to establish a baseline IOP measurement. Instruct the patient to sit comfortably in an examination chair. Measure and record the initial baseline IOP. This is typically done using a tonometer such as Goldman applanation tonometer. We provide a standardized amount of water, usually 800 ml to 1 liter, to the patient and instruct them to drink it within a specific time frame, usually 5 minutes. Monitor and record the IOP at regular intervals after the patient has finished drinking the water. This can be done at 5, 10, 15, and 30-minute intervals depending on the protocol being followed. Observe and document any significant changes in IOP in glaucoma patients. You may see variation in the IOP following the water intake. This is the IOP changes in various patients, POAG, control patients. This is a small video showing the excessive pressure in the trabeculum causing damage. Interpretation of results: normal IOP response, significant IOP increase, delayed IOP increase, IOP fluctuations with slow recovery, nocturnal hypotension, and exaggerated IOP response. Accuracy and consistency in test administration are crucial for obtaining meaningful results that can guide glaucoma diagnosis and treatment decisions. It's essential to adhere to established protocols and use appropriate equipment for IOP measurements during the test. This is the changes in the intraocular pressure from maximum to minimum and the end pressures. Various results. IOP has reached a peak of 35 also. We analyze the collected data to assess how the patient's IOP changed after drinking water, discuss the results with the patient and consider any necessary adjustments to their glaucoma management plan based on the IOP fluctuations observed during the treatment adjustments. Based on the results, consider any necessary adjustments to the patient's glaucoma management plan. This may involve changes in the medication or treatment timings. Follow-up: schedule any needed follow-up appointments or tests based on the water drinking test results. Accuracy and consistency in test administration are crucial for obtaining meaningful results that can guide glaucoma diagnosis and treatment decisions. It's essential to adhere to the established protocols and use appropriate equipment for IOP measurements during the test. Mention any specific instructions or precautions. Its clinical applications are like early glaucoma detection, individualized treatment planning, monitoring disease progression, identifying nocturnal hypertension, evaluating treatment efficacy, research and understanding, and personalized care. It provides a dynamic IOP assessment, identifies normal tension glaucoma, customizes treatment plans, addresses nocturnal IOP drops, monitors treatment efficacy, advances glaucoma research, offers patient-centered care, and enables early detection. Vari- there are various limitations and considerations like variability in results, patient compliance challenges, limited specificity, not a standalone diagnostic tool, standardization challenges, limited evidence in certain populations, resource intensive, diagnostic complexity, and ethical considerations. In conclusion, water drinking test is a valuable tool in glaucoma care, offering dynamic insights into IOP fluctuations. It enhances diagnosis, customized treatment, and contributes to research, but should be used alongside with other assessments and considerations. Thank you.
So the next speaker we have is Dr. Prasanna. Any questions on drinking water test for Dr. Rayees Ahmad? We have enough time.
I want to ask,
Pointer.
so do you regularly do this test?
Ma'am, not regularly, but we are doing a study about it, and there are peaks. Well, we have
So
observed.
in POAG patients or PSCG
Ma'am, not
defined?
defined glaucoma patients. We may also do any suspected patients and see the peaks. Any patient having decreased visual fields or glaucoma progression despite IOP controls, they are the perfect candidates for this.
Because instead in our center we just make sure to tell them that
Don't drink
too
bolus
much
amount of water. There are at some centers hydrotherapy also going, like Ayurvedic hydrotherapy. They are giving 2 liters, 3 liters of water to the patient to treat some renal calculi or anything else. In such cases, this is a useful.
Thank you.
Do other tests also? Other provocative tests, what are the tests you do?
This is a separate test we do. Other diagnostics like OCT and perimetry has to be
No,
kept
provocative
alongside.
tests like dark room test
Dark room test,
or
ma'am.
position, based on position prone.
No, ma'am. This study was alone, separate study.